Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush. Well, welcome everybody to another edition of our podcast. How you doing, Mark?
I'm doing fine. My hockey team is no longer in the playoffs.
Thanks for that. That's very good. Yes.
That's called a segue.
Yes, it's a segue. We have that. I'm being a new hockey fan. Isn't it kind of unusual to score 10 goals in a game? I mean, combined, that's a lot of goals. Well, last night at the first game of the Stanley Cup Finals, the total was 10 goals, 6 for the Vegas Golden Knights and 4 for the other guys. So we're happy here in Vegas.
Yes, you're happy. That is actually quite common when you're playing the Caps.
Yeah.
Yeah.
Okay.
Yeah. If you're scoring 4 or 5, that's pretty much what it takes to beat them because they're going to score 4 or 5 on you at night. So.
Yeah. Well, there you go. They rose to the occasion. But
yep. So
we'll see what happens. Anyway, what we thought we talk about is, there's times in a dentist's career where he or she might just go, what the heck's wrong with me?
Right.
What am I doing wrong? And it can be quite a vexing thing for a practice.
Actually, if you subscribe to any dental Facebook group or Dental Town, about 50% of the content or the questions being asked by the original posters, you can lead back to the question, is there something wrong with me?
Yeah.
Which is fine. I'm not going to get into the psychology of any of it, but we're going to take on the subject of is there something wrong with me? And we're going to expand upon it and we're going to add the marketing side of it. Because from a marketing perspective, there could certainly be points in your career where you look at yourself and go, man, I took all the CE. I think I did pretty good. I feel confident doing this service or procedure. And I think Mary at my front desk is a nice person. I don't think Judy, the hygienist, is heavy-handed. I know Megan, my assistant, is, she seems really nice. I'm not in the chair every minute, when the patients are there. And you get to this point as the owner of the practice, you're like, what the heck is going on? I got to be missing something. There's got to be something wrong with me.
Right. And another symptom might be, case acceptance. They're just, I think I'm presenting the case. I'm not really overselling it. I'm not really cramming it down anybody's throat. But the case acceptance just isn't there, isn't where it needs to be.
Yeah, you see that a lot too. As a side note, this is definitely a side note, but you see that a lot when you buy a practice. The existing patients take a year or so to warm up to you and then trust you enough to go forward with treatment. But anyway.
Yeah.
So actually it's kind of a side note, but that is another scenario where if you bought a practice, you bought existing patient charts, you may think, you may think you smell or something, right?
Yeah.
Right? Nobody's believing you, even though you showed them that fuzzy x-ray that nobody can read.
Yeah.
or maybe you do have an intraoral camera. It's great. It's in focus and you print it out. You give it to them to take home. And obviously there's a crack in a tooth because, you have it on 9000X setting on your camera and it looks like the Grand Canyon.
Yep.
Right, exactly. And they still don't believe you. And you go home perplexed. You're like, what the heck is wrong with me? And then sometimes, you'll have this, what you thought was a great patient interaction. And you think, every indication was that the patient liked it there and liked working with you and the team, and they were cordial and they were nice and they were just genuine human beings. And then they leave you like this so-so review.
Oh, yeah.
Online.
Yeah, right.
So there's another way that you can sit there and look yourself in the mirror and go, what the hell is wrong with me? What the hell? What's wrong with these people? Right. I mean, sometimes it's, you can find yourself saying that, but a lot of times you take it personally and you say, man, what the heck is going on? And after a while, you kind of, you and I have to do the same thing, Howie. I mean, we've had clients over the last 15, 20 years where we just kind of looked at each other and said, you know what? You can't fix that. You know what I mean? Like we tried, we bent over backward and we are perplexed ourselves. Right.
Yeah.
So, it's not just dentists who feel this way, but specific to dentists. I mean, even recalls, like you go and you say, okay, well, it's time for your 6-month, let's schedule that now. And here's the way we work. And, if you're compliant to your recare appointments, we allow you to schedule them 6 months out so you can get the day and time you like. And we hope you keep it so that way we can continue with that courtesy. And you make their appointment and they're like, yep, Tuesday afternoon, 3:30 is perfect for my schedule, fits perfectly and work perfectly with my kids, perfect. And then, they get the text and they don't respond, they don't come in, and you never see them again. Okay? And you say to yourself, what did I do wrong? Like everything comes back to what did I do wrong? Right?
Yeah.
You know what, Howie? We should probably take a break.
Let's do.
All
and
right.
When we come back, we'll delve into this and oh boy, it's going to be fun. Don't go away. Hey, Mark, how would our audience find out about getting more good reviews?
Well, first step is to understand it. There's minefields in the dental business right now. So let me give you the 4 keys. 1, has to be simple for your staff. They can actually call in sick and it'll still work. 2, it has to be ridiculously simple for your patients to leave Google reviews. 3, it has to be able to separate out the not so good reviews from the great reviews and only send the great reviewers over to your Google, Facebook, or Yelp. And 4, and this is probably the most important, only send reviews to platforms where your reviews cannot be taken away. If anybody has any questions about this, it's called NPI Crusader. You can just send Howie and I an email, or actually you can log on to newpatientsinc.com and you can schedule your very own appointment to see it in an online meeting that usually takes 15 to 20 minutes. So most people do it over a lunchtime.
Okay, we are back. And we were talking about the extreme case of introversion that happens when patients don't respond to treatment plan, to recare, to all that stuff. And you're throwing your hands up and you're going, what the heck's going on?
All right. So at some point in your career, all of you listening to this, when we do these podcasts, we try to do these and talk about things that apply to every dentist. And believe me, at some point in your career, you're going to feel like you're going to say to yourself, I think I'm doing everything I can. And I just don't know how I can get a better outcome. Right?
Yeah. Yeah.
Well, rather than depress you all, okay, and keep taking you down this path of distorted reality, many times, not all times, but many, 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 many times, emphasis on the word many, the secret behind all these things that you're feeling is the quality of the patients you're attracting.
Bingo.
Okay.
Yes.
It happens all the time. These same dentists who can't quite put their finger on why people don't really trust them enough to move forward with their treatment, or can't really figure out why they're not as compliant to recare, and can't really figure out why they left. I mean, they appeared to be, just nice people when they were in the office, and they left us a not so hot Google review, right? And it makes sense that a dentist would say, my treatment plan compliance percentage is going down. It must be me. Or they say my treatment plan compliance is going down. It must be my assistant or my treatment coordinator, or it must be the person at the front desk. Or let's say I have lots of broken and missed appointments. It must be the person who's answering the phones. Or if my compliance to my recare is going down, my hygienist must be heavy-handed. So there's lots of things that immediately enter your brain that make perfect logical sense that takes up your energy. Okay? Yeah. And what we're saying is, excuse me, in many cases, for many, many of you, the main solution is to attract the right people to your practice. I can't tell you how many times I've seen the numbers from dental practices, 30, 40, 50 new patients a month. And the dentist is running around on roller skates. And when you run around on roller skates, you have less control rather than more control. I don't think anybody would argue that point. So you don't get to see the nuances or the details of the day-to-day interaction between your staff and your patients. The things start to fade away. And then at the end of the day, you look at your numbers and you say, my acceptance is down. My compliance to recare is down. We have to have a team meeting. We have to have a consultant in.
Yeah, which oftentimes just results in even more introversion.
Right. Well, we're big proponents of good consultants. So don't take that the wrong way. Yeah. I actually was one at one point in my life. So
yes, you were.
So no, we're not nixing dental consulting at all. But a lot of these problems or these things that you can't quite put your finger on will be solved if you attract the right type of new patients to your dental practice. Okay. The bottom half of the dental market are moms who will choose a healthcare provider primarily based on a price incentive, and the top 48% won't. And we see it. There's nothing in marketing that you can say every time, but I'm going to say confidently almost every time. All of a sudden, like a light switch, the doctor's perceived problems that they were having are changed when they begin attracting the right patients to the practice.
Yes. Yeah, that's exactly right.
Okay,
it's almost like a miracle happens.
Right. All of a sudden, instead of the phone call question, do you take my insurance, or how much is my first visit? Or can I take advantage of this $39 exam special thing? All of a sudden, they're asking you questions about dentistry. Oh my God, yeah. There's a change right there.
Yeah, they'll ask you what's this stuff about veneers or implants and whatnot.
Right.
Now they have a reason to ask you questions other than based on pricing and insurance criteria.
Right. So now, how much better does that make the job of your front desk? How much easier? So right there, we just improved the job performance of Mary. Okay. Mary's now more effective. It took one day, literally one day, to change from choose me because I'm cheap to choose me because I offer these life-changing things is literally light and day, next day.
Yeah.
Okay. All of a sudden, Mary's getting the right phone calls. All of a sudden, the patients are going in the schedule. And you know what? They stay in the schedule. Okay. They stay in the schedule, and then you see them as a new patient. Whether you could bring them through hygiene or your chair is totally up to you. You see them, you greet them. There is a warm welcome. They're valuing you for what you do. They're not valuing you because you're $39.
Right.
There's a reason they're in your chair other than your $39. Almost, and there's that word, almost every time, in almost every dental market, in almost every one of our client offices. Okay.
Yeah.
So
it's amazing how wonderful Mary and the rest of them become at their jobs. I mean, they're just they're geniuses now. It's kind of like when you're kids, and your mom says you better not hang out with that crowd over there because bad things will happen.
Right.
So you hang out with bad things happen, and then you change friends and you get better friends, and all of a sudden, hey, you're a good boy now.
Yeah. All of a sudden, you're a good boy. Well, all of a sudden, your hygienist isn't heavy-handed either.
Yeah,
because your recall compliance goes up because these people aren't looking for the next deal the next time. They were looking to have a dentist they keep for their whole life, really, is what they're looking for. All of a sudden, you're a magician because your treatment plan acceptance goes up. You didn't do anything. Right. You didn't do anything. Okay. You didn't spend more money. You spent the same amount of money. You didn't do a thing other than just market differently.
Yeah.
And all of a sudden, you're Tom Lamoli. You can go out and do seminars. Okay.
Absolutely.
Right. All of a sudden, you need less new patients. Let's take a couple seconds and let that sink in. All of a sudden, you need fewer new patients every month. Not more. You need less.
And you don't have to spend as much on activity.
Right. All of a sudden, those things that, remember, we started this podcast out with you going to a CE course and thinking you did pretty good. You passed, right? And now you just want to try this new service on your own patients and on new patients. And all of a sudden, you're actually seeing patients who are wanting, or maybe they've been diagnosed previously by a different dental office, and they're just looking around at who they want to complete this work. And maybe they chose you because you communicated that you do this work, right? Instead of, hi, I'm $39. Right? So anyway, here's the bottom line. We get, I don't know how many, but we get into probably 8 to 10 really good, meaty conversations with dentists and sometimes their team about what's going on, like what's really going on, beyond the numbers. We want the numbers, obviously. We do the analysis on the market area. We determine what we're up against, and then we ask questions, trying to determine what's really going on in this dental practice. And there's lots of dentists out there promoting dentistry based primarily on a price incentive. You know that. I know that. You see it every day, probably in the mail, probably online. You see it everywhere. When you Google anything dental in your market, I'm sure you see it. So nobody's hiding it. The end of the day, though, the impact it can have, or at the end of the day, these practices, they all, during these interviews, before we finalize a marketing plan for them, there's a similarity between what they say. Because the doctor will get off the phone on the speakerphone, get on a private call with us and say, yeah, I'm not really sure about Mary. And Judy, I don't know. We got a little busier and her work kind of slacked off. And I don't know, maybe my hygienist is a little heavy-handed because, we used to have better recall. I know, I agree. I don't need 50 new patients a month, but it just seems like I'm not getting any bigger at that number. And we hear this all the time, constantly, right? It's if it was like 3 or 4 times a year, we wouldn't have a podcast. Okay.
Right.
But this is like 95% of the people who are calling us saying, I don't, is it my marketing? I don't know if okay, here's the bottom line. It is your marketing. Okay. That's what's causing all this uncertainty, right? Is it me? Is it my front desk? Is it my treatment coordinator? Is it my hygienist? Is it my assistant? Okay. Is it the way we're handling the phones or not handling the phones? Is it the weather? Is it the solar eclipse? No, it's none of that. It's your marketing. Okay. If you're marketing to the bottom half of the market, it will always create these outcomes. You will not be the first person to avoid them. Okay. So that's the purpose of this podcast, was to take this subject of the top half and the bottom half of the dental market and invert it and put it in a context that hopefully you would understand, because you have the same feelings on a day-to-day basis and you can't quite put your finger on the solution. You don't even know really what the cause is, but you're looking for a solution. Well, that happens all the time. It happens to some things happen to our business and we can't put our finger on it right away. So we're not passing judgment. These things happen to every business owner everywhere in the world. But specific to dentistry and specific to marketing a dental practice, promoting your practice to the wrong half of the dental market almost 100% of the time will generate these feelings of uncertainty that you have in yourself and your whole staff, and maybe even your office in general, your location. And it's I'm not going to say it's needless. In other words, you don't have to deal with it. You can and you don't have to spend money to change it. Just the same money that you're spending now, just in a different place. Yeah.
And also that comes with the probable change in the marketing message. You have to drop away from the price incentive side of things and promote the benefits of modern dentistry.
Absolutely.
And the miracles that you and your team can actually perform on people that they don't know about. So,
right. What you're probably missing is the confidence that will work.
Yes.
And we wouldn't be here if it didn't. And we wouldn't have hundreds of clients. We wouldn't have hundreds of clients for 15 years, just mindless drone dentists throwing money at us every month for 13 years. It doesn't happen. Okay. No. So anyway, so when you get to that point where you're kind of feeling like, yeah, something's not right? And you can't figure it out, look at your marketing. Look who you're trying to attract to your practice. It might just be your patient pool.
Yep.
All right.
Very good. Well, thank you for joining us once again. And we're very happy to have you out there in the audience. And if you have questions or something, email us. What's our email address again? Info?
No, let's do
it's Josh.
JOSH at newpatientsinc.com.
Yeah, and we'll do a mailbag segment again one of these days. But thank you today for joining us, and we'll look forward to talking with you next time. Bye now. We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites, dentalwebcontent.com and newpatientsinc.com.